Once you're dealing with people with different values, then you have to go a step further. And that's where you ask yourself not treat others how you would want to be treated, but rather ask others how they want to be treated.
My name's Sarah and I'm 16 years old. I recently went to get an STD check at my local GP's office. I felt really judged when I started opening up to the doctor about my sexual history. I was too scared to ask her any questions, so I ended up pretending I knew what she was saying just so I could leave.
My name is Anika and I am 43 years old. I was recently rushed to hospital after fainting from low iron levels. The doctor assigned to me told me that all I needed to do was eat more animal-based protein and I would be fine. In my culture, we practice a vegetarian diet, so the doctor's comment felt ignorant and careless. I didn't feel my cultural beliefs were being considered.
My name is Mary and I am 75 years old. I was recently diagnosed with Alzheimer's disease. This diagnosis made me feel very distressed, but my doctor provided me with little emotional support. He was focused on making sure I understood the diagnosis and that I was going to follow my treatment plan. He made me feel like I'm incapable, like I've lost my intelligence. I don't want to return to my doctor.
My name is Ahmed and I'm 27 years old. I recently attended my local general practitioner because I was experiencing sharp pain in my left shoulder. During the appointment, I couldn't understand the terminology the doctor was using, as English is not my first language. I nodded my head to what the doctor said and left the appointment not knowing what to do about my shoulder. So what are we going to do about it?
Clinicians must start utilising different forms of communication so that each patient has a unique experience. It is important for patients that their clinician put them at ease, listen to them and take them seriously.
Clinicians need to act on the diverse cultural needs of our patient population. Cultural competency requires commitment from clinicians to be responsive to the different attitudes, verbal cues and body language of the patients that they are caring for.
It is important that clinicians take into consideration the emotional impacts a diagnosis can have on a patient. It is understandable that there is a pressure to fulfill the institutional role of a clinician, but using empathy and reassuring the patient can minimise negative emotional impacts.
Let's spread socio-cultural awareness about making communication great for different people in a clinical setting.